gastric sleeve surgery on your mind? Trying to find answers about eligibility, techniques, advantages, and recovery? We have Dr. Hector Perez, who is not only an expert bariatric surgeon with 17 plus years of experience, but also has undergone weight loss surgery himself. Let's hear all about this from him straight. What is gastric sleeve surgery?
Gastric sleeve is a restricted procedure in which we're going to be removing between 75 and 80% of your stomach. On the stomach that we remove 90% of the production of a hormone called ghrelin, which is called also the hunger hormone. This surgery works in these two ways. It's going to make your stomach shrink to a 20% size, but also will remove hunger in 90%.
Am I eligible?
Any patient with obesity, meaning above 30 BM.
How is it beneficial for me?
The advantage, I can say that being just a pure restricted procedure, we don't change the anatomy of your bowels. And most of the absorption of nutrients is preserved. So usually patients with gastric sleeve don't need to take vitamin supplementation for the rest of their lives like other procedures. I usually send my patients bariatric vitamins for at least 6 to 12 months till they reach their ideal weight and they can stop.
How long does it take?
The duration, it's usually a procedure that takes us between 30 and 40 minutes at the most, depending on the BMI of the patient.
What is recovery like?
Patients come out of surgery and they start walking the same day, okay? They can sit, they can go to the toilet by themselves, shower. Usually on the States, patients stay only for one night. We always keep our patients for 2 nights because this is, again, medical tourism and we need to make sure patients are 100% good to go by the time we discharge them. On the first day of surgery, you're walking, you're sitting down, you start with some ice chips at night. On the morning, you will start with some Gastric. We'll do leaking tests, and then we can send the patient to their hotel. I always recommend patients that they can take a week off of work. Some patients can't, especially those patients that work in their home with their computer. They can start working immediately. But if you have a very physical job, I always recommend patients to take at least 1 week, but the ideal will be 2 weeks. After 2 weeks, you can start walking fast. The question that we get the most is, hey doc, because patients are very motivated. Hey doc, when can I start exercising? We always recommend exercise 4 weeks post-op, and it has nothing to do with the surgery. What do I mean? Patients think that if they go to the gym, they can harm their surgery. Usually, patients stay in 1 week clear liquids because that first week, the time frame we need for the stomach to heal, okay? So that's why we give a progressive diet to all bariatric patients. Clear liquids, then full liquids, then chopped food, and then food. So the thing is that if you start exercising before 4 weeks, that you by the 4th week, you're already getting more calories in your body. So if you're exercising in a 2nd week, a phase 2 diet, you may feel terrible. Your blood sugar may be very, very low.
How much weight can I lose?
Every patient's different. What do I mean? If you're a patient with 35 BMI, you most likely gonna lose 100% of the excess weight. But if you need to lose 250 pounds, maybe you will lose only 70%, okay? Remember, every patient is different, okay? So if we would like to talk about an average, well, gastric sleeve has an average weight loss of between 70 and 80% of the excess weight loss. But again, if a patient needs to lose 50 pounds, 70 pounds, 80 pounds, they're gonna get there.
MBS guiding you on your weight loss journey.